Welcome to the Health Links podcast, where we bring you conversations that empower healthier living. Welcome to the Health Links podcast, where we engage in conversations that empower healthier living. I'm your host, DJ Thatcher. April is Parkinson's Awareness Month. We're going to discuss that for a moment, but also take a different approach as we discuss how pickleball is being utilized to help patients and their families with Parkinson's disease. We're joined today by Abby Ramsey, who's the Marketing and Member Services Manager from MUSC Wellness, and also Dr. Vanessa Hinson, who is with the Department of Neurology at MUSC. Abby, Dr. Hinson, welcome to the Health Links podcast.
Good to be here.
So, again, April is Parkinson's Awareness Month. Give our audience, Dr. Hinson, an overview of Parkinson's disease, first of all.
Yeah, sure. Happy to do that. So Parkinson's disease is the fastest growing neurodegenerative disorder in the world. So right now, there's about 10 million people living with the disease, but we project that by the year 2050, there'll be 25 million people living with Parkinson's disease. So this is very relevant for our society today that we talk about Parkinson's.
Yeah, sure. Why the big spike? I mean, that's huge. What's
that's
happening?
A great question. So number one, we all live longer, right? So we all see diseases more that are associated with aging. So Parkinson's, for example, is more common in people over the age of 60. Okay. And now that we all live in our 80s and 90s, we see more of that. But that's not the whole story. There are also important other elements to consider. So, for example, genetics play a role with Parkinson's disease. You can have a gene that makes you susceptible for getting the disorder, but that gene alone is usually not all you need to get Parkinson's. A second factor would be in the environment, and here's why we think the incidence of Parkinson's is increasing, because we are increasingly exposed to toxins in our environment.
I wondered.
The plastics and spraying the golf courses with herbicides and pesticides, which makes the grass really nice and green, but those are neurotoxic. And so if a person carries the at-risk gene for Parkinson's and is then environmentally exposed, they will develop Parkinson's disease down the road, perhaps another neurodegenerative disorder, like you mentioned, dementia. Alzheimer's disease could be the result of that as well. So as we are more industrialized, we see more neurodegeneration happening, sadly.
We heard that stat about golf courses with one of our discussions about Alzheimer's, I believe it was. And if you live near a golf course, you have this higher risk. And of course, now we're in Charleston, but anywhere in South Carolina, we've got this just prevalence of golf courses.
Yeah, so it's a 1 mile radius. So if you're within a 1 mile radius, this is when you're risking.
It gets into the groundwater? Is that the problem?
So the toxins are found in the groundwater. That's correct. Yeah.
So watch it if you're near a golf course. Get your water tested. Huh?
So if a person has Parkinson's, Parkinson's is, like I already mentioned, neurodegenerative. So that long word means that brain cells die off prematurely. And with Parkinson's disease, predominantly those are cells making a neurochemical called dopamine. And dopamine is responsible for fluid movements. So if we don't make enough dopamine because we have Parkinson's disease, our movements slow down, we become stiff, we might develop a stooped posture, shuffled gait, and some tremors. Those are very common symptoms. But then dopamine is also important for mood. So if a person has Parkinson's disease, oftentimes people are sad and depressed and more anxious. So those are the so-called non-motor signs of Parkinson's disease. And then it can lead to thinking problems, mild cognitive impairment, and in some instances also Parkinson's disease dementia. So it really affects the person as a whole. Okay, interesting about that. I know most people probably associate Parkinson's disease with tremors. That's probably the most common thing they associate. But is that an early sign, or does that come later, or what should people be watching for if they're concerned? Yeah, great question. And here's an answer you probably wouldn't expect. The earliest sign of Parkinson's disease is acting out your dreams and losing your sense of smell. So those are not signs that the lay audience would typically
acting out your dreams. I'm thinking about that now. What's an example of what?
So here's an example. Your wife says to you in the morning, DJ, you were screaming last night like you were following a bad guy or something like that. So acting out your dreams. In our dream stage of sleep, which is usually the REM sleep, right? Everybody's heard about REM sleep. We dream actively, but we don't move. Our muscles are basically paralyzed. In Parkinson's disease, or in people who will develop, who are on the way to developing Parkinson's disease, that paralysis is lifted. They move when they're dreaming. They scream when their dream is not pleasant.
Sure. Yeah.
They might sing when they're in, the opera in their dream. So very active sleepers. 10 years before the motor symptoms of Parkinson's emerge.
Wow.
People might lose their sense of smell years before motor symptoms of Parkinson's emerge. So those are some subtle signs that something neurodegenerative is on the way. Another sign, and it sounds very benign, is constipation. Chronic constipation. Not alone, but together with that dream enactment and with that loss of sense of smell, makes us very suspicious that person might then later develop the motor or movement difficulties associated with Parkinson's. And coming back to your original question, would tremor be an early sign? Absolutely it can.
Is it? Okay.
And typically, and here's another interesting one, it's one side of your body. So your right or left hand, it's a 50-50 chance, might start trembling, usually at rest. So somebody just sitting in the chair and they're watching a television show and their hand might shake. One hand, not the other.
Interesting.
That could be an early sign.
Does it progress to both sides eventually, or does it stay on one?
But it's usually always asymmetric. So even though somebody with 10 years of Parkinson's, 10 years into the illness, might have some tremor on the other side as well, it never catches up with the original side. Isn't that interesting?
I was watching a national television show, and I won't mention who it was, but the person was holding a paper, reading from it, had a guest, sort of like what we're doing now, and I could see that the person's hand was just slightly, I said, I wonder if because the person may be 60, 70, I wonder if he has some early Parkinson's. What you think about, when you see that.
Right.
And maybe he's nervous, I don't know, but it sure looked like.
And that's a good pickup that even a lay person can make. But here's something I need to share with your audience. Not everybody with Parkinson's has tremor, and those are the people who get misdiagnosed and completely missed. Wow. And that's about a third of all people with Parkinson's disease never develop tremor. And so they go to the doctor and they just don't feel well. They might be fatigued. They might have that dream enactment. Don't tell anybody about it because they don't know what it means. And they don't get the diagnosis soon enough because they don't have that obvious sign, which is the tremor. So it's good to know there doesn't have to be tremor.
Okay. So as a neurologist, how are people coming to you? Are they coming directly with various symptoms, or are they being referred from a primary care provider, or what's the typical course?
Most commonly, it's our colleagues in primary care who send the patient to us.
They have a higher suspicion, obviously.
Correct. So. And, 2/3, we already said, of patients have tremor. So tremor is the most common chief complaint of why a person with Parkinson's would see a neurologist. Second most common would be walking problems. So the spouse might say, my husband is shuffling. I can hear him come down the corridor. Pick up your feet and pick it up. So, and they get checked out by their primary care who says you need to see a neurologist. But here's another thought I wanted to introduce. Seeing a neurologist is still seeing a generalist. There are Parkinson's specialists, and most people don't know what they're called. So we, Parkinson's specialists, are called movement disorder specialists. And so when you have Parkinson's, or you think you do, you should see a movement disorder specialist. So when you have chest pain, you would see a
cardiologist.
That's right. Good job. And not your GP necessarily, right? So when you think Parkinson's, you should say, well, let me Google who is the nearest movement disorder specialist I would see. We
have a fair number of people who watch the podcast who are medical people or considering a career in medicine. So obviously your background, college, medical school, neurology residency, and then the movement specialist, is that a fellowship or after?
You're right. That is a 2-year fellowship.
Wow, okay.
And there are fellowship programs around the country, and there are not enough movement disorder specialists to see all the people with Parkinson's disease. Right now, if one has Parkinson's, you have a 99% chance of ever seeing a movement disorder specialist.
Wow.
So one of our jobs at MUSC is to train the next generation of movement disorders fellows to then become practicing movement disorders neurologists to help everybody with Parkinson's disease. Yeah.
Well, Abby, let's bring you in here. So now your role, you're a manager within the program. You are also a certified professional pickleball registry instructor. Did I get that all right?
Yes, yeah.
In fact, you both are. Is that correct?
Yes.
And so we're talking about pickleball. How does the pickleball fit in with Parkinson's?
Yeah, so one of the things you'll hear with people with Parkinson's is that exercise is their medicine. So what we bring with pickleball is they're moving, but they're also focusing on movements that combat the issues they're having with Parkinson's.
I see.
We base the program basically off of what we call movement patterns. Those movement patterns are to work with the things that Dr. Hinson just mentioned about that, the slower movements, the small movements we work on, big amplified movements to combat those issues.
I see.
And basically just work that into the curriculum of teaching them pickleball.
Wow.
So we're still, we're having fun with pickleball, but we're also working on things to combat their disease.
Okay. So now you have this program called
Pick It Up. Yeah, Pick It Up for Parkinson's.
For Parkinson's, yeah, with and pickleball is a key component of that.
Mm-hmm.
So you were telling me before we went live here that this is a program you've developed here with the MUSC Wellness, and it's the first in the country. So tell us a bit about the Pick It Up for Parkinson's and what that's all about and how you came about developing this.
Well, the whole reason why we thought about this is because when a patient comes to see me, I don't have a medication that will slow down the disease progression of Parkinson's disease, which is frustrating, right? So
there's no magical pill.
No,
okay.
no, but there's good pills. So I don't want to discourage people, but the pills treat symptoms, but the disorder is still brewing.
Okay.
We want something that slows down the progression or stops the progression, ideally, right?
Sure.
So research has shown that exercise currently, today, is the only weapon that will take the edge of the disease progression of Parkinson's disease. And exercise means 150 minutes per week of vigorous exercise. So walking to the mailbox, good thing
That's
you
right.
get the mail, but it doesn't count.
Okay,
Sorry.
gotcha.
So, but playing pickleball is a great example of something that counts. So we were sitting down 3 years ago, and we're trying to find a form of exercise that people love.
Mm-hmm.
Well, pickleball right now is the most popular sport in this country.
Yeah,
More people play pickleball than tennis. Sorry, tennis player.
We had this discussion
But
beforehand. Yeah.
it is a fact. And so people love it, which is great because that means they stick with it and they get close to their 150 minutes.
Wow.
But it also has, Abby was referring to these movement patterns. If you think about what movements are relevant for pickleball, the movements are relevant for Parkinson's disease.
Okay.
Think about an older person, Parkinson's. You have somebody in mind who has maybe a stoop posture.
Mm-hmm.
Well, if you hit an overhead in pickleball, you're going to be having an upright posture.
Right.
Because otherwise, you're going to
You're
miss
hitting
that
it,
ball.
yeah.
Sorry,
Right.
it's going to hit you in the head. So you're going to be upright. Your forehand swing is going to be a big swing. With Parkinson's, your movements, you know that as an instructor, they're small and slow and stiff. We don't have that big swing, but we are teaching it to the pickleball player with Parkinson's to have a big forehand, a big backhand, so big swings, big movement patterns.
Okay.
We're teaching balance, agility. We teach people how to fall, because obviously there is a fall risk with any sport, including pickleball. And if your balance is impaired because you have Parkinson's, you better know how to fall safely. So that's a component of something we teach in the program.
Sure.
And we incorporate these movement patterns that Abby was talking about already in the warm-up, and then throughout our lessons to show people Parkinson's, A, that they can play pickleball.
Wow.
B, that it gets them to the 150 minutes of exercise, and C, how to do it correctly, safely, and successfully.
Wow.
And they're having a blast.
I bet.
Yes.
You mentioned earlier, one of the early signs is the shuffling, and my background is mostly in trauma. We see falls all the time. People shuffle, they hit a rug or something and fall, or if they're on blood thinners, all sorts of problems. So I can see how this would help. So is the large motion exercises, is that helping to retrain the brain somehow, or what's really happening within their body as they're doing this?
Yeah, so two things. So number one, why did I even say exercise takes the edge of the disease progression, right? This is way beyond exercise, good for everybody, that's a good statement, but it's much more precise. In response to this vigorous 150 minutes per week exercise, the brain produces factors that keep brain cells from dying. They are neuroprotective factors. The most commonly known one is called BDNF, brain-derived neurotrophic factor. In presence of the brain-derived neurotrophic factor, your dopamine cells will stay alive longer. The other factor is called irisin. So irisin also works in the same capacity. So while there is no BDNF or irisin pill, injection, transplantation doesn't exist yet, with exercise, we see this upregulated. So at the end of the pickleball session, you might have won the match and you might have more deep BDNF circulating. It's amazing. So that's one thing. And then, with the big patterns, maybe Abby can say how you're teaching these big motions to our people with Parkinson's disease.
Yeah, so again, we call those our movement patterns. That's basically what the whole curriculum is based off of. We are tell them to exaggerate, basically. So we do the movement patterns as part of our warm-up, and to get ready for that day, especially between, that class from late last week all the way to that next Monday class. It can be a long break, so we do them every single class to keep their minds fresh. We say a big thing with Parkinson's is with that shuffling and stuff, we say talk to your knees, talk to your hips, because that connection from your brain all the way down to your feet is a lot longer than that connection from your brain to your hip or your brain to your knee. So we tell them, lift that knee up, talk to your knee, get that big movement in there. And that really helps them get ready for the actual play that we're going to do. Because all the movements that we do, especially their big lateral steps, a lateral right, a lateral left step, are very, very transferable to actual pickleball skills. Yeah.
Interesting. Okay. So how many people do you have in the program? And I guess they're all coming to you at MUSC Wellness in downtown Charleston, correct?
Yes, come into our location downtown at the MUSC Wellness Center. Okay. We can have a max of 12 people because that's what our courts support. We need a minimum of 4 because that's how many you need to play pickleball. We do focus on doubles just because it is a little bit less movement than singles in pickleball. Singles is played a lot more like tennis, so a lot more moving around. So we do focus on doubles. So minimum of 4, max of 12. And that can be relevant to the amount of coaches that people have available too. We're lucky enough to have 3 coaches on staff.
Oh, nice.
So we can have, our coaches play with people if they need to. But yeah, max 12, minimum
So
4.
these 12 participants come twice a week for a duration of 8 weeks.
Okay.
So that Pick It Up for Parkinson's disease program is a progressive program. In other words, in the beginning, some people might have played pickleball on their own, but they probably didn't have proper training. So we get people trained up in a successive manner so that they build skills from one session to the next.
Over 8 weeks.
Over 8 weeks.
Is the hope then after 8 weeks that they just continue this on their own, or do they come back?
Exactly. So you graduate from Pick It Up.
There you go.
And then you can go to another program that's called Put It in Play, which is essentially coached play. So people will compete and play against other people, but the coaches are still there. We give them tips and still correct form.
Interesting.
And then after that, you finally graduate to open play.
Okay.
That's
okay.
The goal is to get people playing in their neighborhoods, playing at the wellness center, playing wherever they live.
Sure.
Because we're not done with exercise after 8 weeks, and this sets us apart from physical therapy.
We are discharged.
Everybody's done physical therapy. Right. The physical therapist said, you're done. You've met all your goals. And you're like, I still have Parkinson's. Well, find something on your own. Yeah. This is the on your own part of this.
Right.
This is a lifestyle change. Sure. This is not a limited intervention. So the whole purpose is that people come out of the program, know how to play, and now play in their neighborhoods.
Right. You had mentioned too, which was very interesting, that let's say I have Parkinson's and my spouse wants to come along. You have mixed doubles, I guess. Is that right? You can have the spouse without Parkinson's playing with a spouse who has that. So.
Yeah, we always encourage spouses to come and play with us if they want to, especially so that they can then go play together in their community. Yeah. We like to call them their pickle pair, so that's what we call them.
Pickle pair, I love it.
Okay. Pair. But yeah, and it always encourages them to, we hear stories all the time of, now I taught my grandkids how to play, I taught my kids how to play. So I feel like that's one of the biggest rewards we can get out of this, is that they can then go on to teach their family members how to play.
That's really neat.
It is, it's great to see that.
I know that this program started not quite 2 years ago, I guess, and your goal is to really spread this everywhere. Is that correct?
Yes, this is going to be a nationwide program. We're working with Selkirk and PCI, Pickleball Coaching International. We are about to finalize our coaching program. We want to teach other pickleball coaches in the country how to coach people in the Pick It Up methodology, so that people with Parkinson's disease in the USA can learn how to do this and play it wherever they live. So we're actually going to the World Parkinson Congress in May. We have an invitation to run their pickleball room.
Interesting.
There's going to be about 4,000 delegates at the Congress.
Wow, where's that being held?
And that's in Phoenix, Arizona this year.
All right.
So this is only held every 3 years. It's a big event. So having Pick It Up present at World Parkinson Congress is a big deal.
Yeah, you've got a lot on the line here.
Yeah.
That's
right.
Really neat.
That's right.
That's really neat.
Yeah. So. Our inspiration really with this, to some degree, is, I don't know if you've heard about Rocksteady Boxing, which is another amazing exercise program for Parkinson's disease. And Rocksteady Boxing has, I think, 850 locations now worldwide.
Wow.
So if we could get to that from 1 to 850, we would call ourselves successful.
That's terrific, I would say. For people who are listening and they're thinking, okay, this sounds really good, I'm concerned that maybe I or someone I know has Parkinson's, maybe they don't want to go down this path, or maybe they're not local right now. What other kind of exercises could they be doing that mimics what you're talking about with these large motion exercises with pickleball?
So first of all, I said this is different from physical therapy, but
Right.
physical therapy is always a good way to start.
Okay.
So I would say start with a program that is national. It's called LSVT BIG, or Power for Parkinson's Disease, which is a physical therapy program where these big motions are taught.
Okay.
And then once one graduates from that program, go into a community program that doesn't have to be pickleball.
Mm-hmm.
So here's the good news. It can be any form of exercise that gets your heart rate up, that has some cardio elements, some weight elements. That would be great. And then once Pick It Up is available in your neighborhood, you sign on to that.
Do that, right.
But the benefit of exercise is not specific to one form of exercise over another. If you don't like to swim, you don't have to go in the water. If you don't like to box, don't do rock steady boxing. Do
Sure.
pickleball. If you don't like pickleball, go jogging. So it is not
something.
specific.
Yeah.
That's correct.
Yeah.
So if somebody loves just going to the gym and being on the treadmill or the elliptical, that's fine. Just hit your minute goal
Love
and
it.
you'll do fine.
Terrific. What else should people know? Anything else we're missing?
Only thing I would add is the social aspect that this program has.
So important,
It is such a good community builder to find other people who are dealing with what you're dealing with, even if that is spouses connecting with spouses or the actual patients connecting with patients. But it is one of the most rewarding things, and we've had this happen multiple times when our participants come to us at the end of class and they say, I've just had a really rough last couple of days, and this has provided such a good stress relief for me. I've got to come here and see my friends. I've gotten to see you guys as coaches.
Wow.
It's really just, again, so rewarding to be able to provide that safe space for these people. And they just get so comfortable with each other, and they form lifelong friends. They go out and play in pickleball in the community together.
Wow.
And that's, again, our overall end goal is getting them out there in the community and playing safely.
That's a great point. When we covered Alzheimer's and dementia in recent podcasts, that was a big aspect of it, the withdrawing. People withdraw from social interactions. Are you seeing that with Parkinson's as well? I figured it might go along with it.
Yes. So we do see social isolation. We see sometimes apathy, not initiating activities that should be fun. You know, like, this should be fun. It's like, I don't want to do it. And it's different from depression. It's the lack of initiation.
Sure.
So people to keep more to themselves, which is not good for them.
Interesting.
So pickleball undoes that.
Yes, yeah.
For sure.
Very social sport.
Terrific. Someone's out here listening thinking, I want to jump into this. How do they get in touch with you?
Yeah, so our clinical exercise program coordinator, Cindy Day at the Wellness Center, is the one who coordinates the program, runs it, does like physician referrals and stuff like that. So you can contact her at dayc@musc.edu.
We'll put the links here.
Yes, yeah. We also have information on our Instagram at MUSC Wellness Center, on our website, MUSC Wellness Center, if you just Google us. And then I don't know if there's any other...
Yeah, and for clinical care, if anybody wants to come to the movement disorder specialist at the Center of Excellence, the best nurse coordinator to email would be cool@musc.edu, just like the weather in Charleston at all times.
Right, yeah.
Yes, easy one to
4
remember.
days a year. I got it. Well, this has been terrific. Abby Ramsey from MUSC Wellness, Dr. Vanessa Hinson from the Department of Neurology, thank you so much for joining us here on the Health Links podcast.
Thank you for having us.
And
Thanks.
stay tuned for the next episode where we'll engage in another conversation where we empower healthier living. I'm DJ Thatcher. Thank you for joining.